afternoon, everyone. I am Catherine Brookman, Associate Director, Knowledge Transfer and Exchange, and on behalf of Dr. Jack Callahan, Director of the Center of Research Expertise for the Prevention of Musculoskeletal Disorders, or CRE-MSD as we are more commonly known, we'd like to thank you for joining us today for this free webinar series on work from home and beyond, a holistic approach to addressing technology, ergonomic, and organizational factors. We'd like to thank and acknowledge our health and safety system partners who support and collaborated with us on this series today, specifically from Public Services Health and Safety Association, Tanya Morse, Infrastructure Health and Safety Association, Peter Vai, Workplace Safety and Prevention Services, Don Patton, and Dwayne Fuchs from Occupational Health Clinics for Ontario Workers. We are grateful to the Ministry of Labour, Training and Skills Development for our funding, which supports the delivery of these webinars, and to our presenters who provide their expertise. We ask that you keep yourself muted for the duration of the webinar as a courtesy to the presenters and all the participants. During the question and answer period, we ask that you type your questions into the chat box. The chat box can be pulled up on your screen by selecting the chat icon in the control panel that appears near the bottom of your screen. I will relay these questions to our presenter today, or a similar question should we have duplicate themes. However, should you have a pressing question or issue such as a technology glitch that cannot wait until the end of the presentation, please type this into the chat box and we will do our best to address it right away. The format of today's webinar is as follows. The presentation will be given, after which time we will have 10 to 15 minutes for a question and answer period with our presenter. This webinar will be recorded, with the recording being made available to you on our website, along with the presenter slides shortly after today's webinar. After the webinar, you will be sent a link to an evaluation. Please fill this evaluation out, as it will assist us in the future delivery of our webinars. We'd like to thank you so much for joining us today and encourage you to watch the CRE-MSD website and the MSD prevention site for new resources and events. Now it's my pleasure to introduce to you our presenter. Dr. Michelle Robertson is the Executive Director of the Office Ergonomics Research Committee, a lecturer at Northeastern University and the University of California, Center of Occupational and Environmental Health, and a research faculty member at the University of Connecticut Psychological Sciences. Dr. Robertson has dedicated more than 20 years of her career in systematically designing and evaluating organizational and training interventions that include participatory and macroergonomic approaches, work organizational factors, training system design, computer work environments, office ergonomics, and designing integrated wellness and ergonomic programs. She is a fellow of the Human Factors and Ergonomics Society and International and Ergonomics Association. Currently, Dr. Robertson is working with the Center for Promotion of Health in the New England workplaces, developing an organizational readiness survey and supporting outreach activities. Dr. Robertson is a board-certified professional ergonomist and holds a PhD in instructional technology and a recipient of several awards. Thank you so much, Dr. Robertson, for offering to do this presentation for us today. Now, over to you.
Thank you, Catherine, and thank you, CRE-MSD and Patina and Dr. Jack Callahan for this wonderful opportunity to present to you some thoughts about how we move from working from home, working in remote offices, and looking at hybrid offices, which are just around the corner for all of us. So good day to all around the world. Good morning, good afternoon, good evening, and I look forward to hearing from you, and we will have some good interactions at the end. So today I would like to speak to you about telework, virtual office, and the hybrid offices. What are the challenges? Present to you with a work system perspective that pulls together the individual, group, and the organizational factors. I'm also going to be presenting results of a virtual office intervention study that we conducted. These are preliminary results, but I want to share them with you because these results and findings are important when we're moving forward to set up some guidance from an ergonomic occupational safety and health perspective to help our workers move into different work arrangements. And that will lead to our last discussion, which will be on practical implications and programmatic recommendations. What's interesting is telework and remote work is not a new concept. With the introduction of human-computer interactions back in the 70s, we started to work from home and started setting up different flexible alternative work arrangements. The research has really been occurring in this area for about 20 years or so and identifying several challenges and benefits of telework and virtual office. What is interesting is that we just don't quite understand. There's a lot of mixed results in the research, positive and negative effects for employees and managers who are involved in some kind of flexible work environments. So the question has always been, how do we manage teleworkers? How do we manage distance management, distance leadership, so that managers know best how to work with teleworkers and virtual office employees and be able to provide those organizational support and resources to ensure that their workers are safe and healthy and their productivity is being supported. So as we look forward and adopt some of these new creative ways of working at home, it's important for us to pull together some guidance on these human factors ergonomics programs and issues, because what we want to do is provide some sustainable programs. And what are some of the key recommendations as we go through these different telework adventures? Obviously, when we looked at the research many years ago, we weren't under the COVID pandemic. So let's take a step back and say what was being identified as successful telework programs many years ago. Well, one that was very consistent in the literature is to plan and evaluate a type of telework program. So when I say telework, remote work, virtual office, these terms are used interchangeably. It's primarily that we need to establish a formal plan and evaluate the feasibility of the program that's being implemented. Rarely were organizations going through an evaluative program, so they would plan it, they would roll it out, and then they were realizing they needed to kind of do some course corrections. What was the feasibility? And that led to they were really starting to understand and identify what were the appropriate jobs, what were the individual preferences of individuals to work in a telework situation or to work in a conventional office workspace. What were the skills that these employees and managers needed to have in order to be productive workers, have interactions with their managers, with their coworkers? And we started to realize, and the literature started to say, that we have informal policies. So if you can imagine, there's this continuum of an informal policy of sending the workers home, do your best, here's your laptop, off you go. Two organizations that really sat down and established formalized policies. And when I say formalized policies, it means not only the virtual office policies, but it also has to include the organizational values, the culture, the norms. How do we make sure that those are all being incorporated so that the person and the managers still have that sense of belonging to that organization? Therefore, getting commitment from senior managers is critical. Then you get into different countries, and this is what the World Health Organization is looking at, as well as the International Labor Office, is how do we address some of the legal issues? How do we make sure that when we go in and select these individuals, that the inclusion of people that can become teleworkers is that it's fair, it's including them and providing them the right tools, and also bringing in those norms and those shared experiences that those teams have. It changes. Yes, the digital age is here. We're able to have our Zoom meetings, but that's still very different than a face-to-face meeting. So we need to consider, how do we establish training programs? How do we roll those out? How do we communicate the role expectations of the employees and the managers? How do we make sure that when somebody is at their home environment or at a satellite kind of hub, how do we make sure that they know how to individually set up their work environment from an ergonomic perspective, as well as how to collaborate with their teams, as well as reaching out to their managers? That infrastructure and the support of the information technology is critical. There's lots of software and groupware out there. But again, the training component is important so people know how to use them, when to use them, and what do you do to engage your employees and your managers. So back in this era, it was kind of the conclusion that telework may not be for everyone. The job tasks, the role responsibilities may not be amenable to support that. Then we had COVID-19 pandemic. So now it's mandatory that everybody is home. And so I think we need to look at what were some of these successful programmatic elements so we can understand the challenges and start moving forward and helping those hybrid environments, because now the new normal is going to be a blending of a hybrid, working sometimes at home, working sometimes in the office. Again, it's a continuum. So let's look at what some of these challenges. If we go to the upper left here, we all recognize that social interaction. There's a lack of that. Sure, technology can help with some, but sitting down and seeing people, their facial expressions, we're missing some communication there. Social isolation is extremely important for mental health and physical well-being. Then we move over to the right. The flexibility is now you have job control and you have job autonomy. You can kind of establish what you're going to accomplish that day, when and how you're going to do it. But that moves now into distance managing. Your manager must understand and trust the process of you completing your work, how you're setting up your work environment. Do you have the right tools and equipment to do so? So then it moves into, we thought COVID would be over in a few months, and now it just keeps trudging along. So now we're moving into questions about mentoring. So employees are reaching out and saying, gee, out of sight, out of mind, are my managers going to still help me with building my skills, continuously learning, and that mentoring? Then we move into different kinds of collaborative teamwork and challenges we have there. We're around the world. Teams are around the world. Timing is critical. So the dependency of gaining information from your other teammates is going to be essential. So now our work hours sort of extend out. We have this sense of, I'm going to show that I'm a very productive employee. So I may have flexibilities, but now my work hours are extending. And my workload is sort of increasing because I want to make sure that the rest of my team, for instance, is getting the information that they need to do their job. Our work environments. We mean moving into hoteling, working into satellite, kind of computer hubs, they're calling them, and we may be working full-time in our home environment. So how do we set up our physical work environment, which leads into the work-life balance? The blurring of the lines between work and the life in your family. Now we're working at home. We have children that are learning at home. So we have lots of blended environments that are occurring there. And that blurring has to be understood by the managers and communicated well to the employees. Healthy computing habits. Having a sense of autonomy and job control allows you to bring in some healthy work practices. The technology, we can have tele-ergonomics now. We can reach out and have ergonomic assessments with people showing pictures and walking through. And can we blend that into possibly bringing people back in teams or groups to set up ergo buddies to help apply that, and then you go back to your home. And we're all on the internet, so security is very critical for this confidentiality of data. So let's take all of these components and look at the various systems approach here. We as an employees in the center of the circle here, and the technology, the organization, the physical environment, and the task, we're all working together. So when we look at our different technology issues, we need to move them in to the three levels that I was speaking about. One is the organizational level. The structure and the design and the processes need to be aligned with the types of jobs that people are now doing. So we have personnel training, we have technology issues, and then we move into the group level, which is understanding the psychosocial and the work organization. So there's also personnel and technology issues to bring in. At the individual level, you have the interaction with the physical environment, the use of the human machine computer interaction, personnel's my skill sets. Do I know how to use this technology? Do I know how to set up my work environment? And can I best design my job for my day so I can maintain that work-life balance, the ability to disengage? In the external environment, we couldn't have a better example than what we're looking at right now with COVID. So here's some examples of what I would call the individual level. We see a variety of work environments. How do we provide guidance to those individuals? Then when we're looking at the workstation, the technology, how do we bring in the psychosocial and the work environment factors? And as you see, many of these factors under the psychosocial work organizational is the work-life balance, your career development, social isolation, what we call the telepresence, which is I have to reach out for communication using the digital technology. We all need, because the success of these programs is the planning, implementation, and the evaluation. So we need to set up, how is it working? What are the key performance indicators? What is the effectiveness outcomes? So when we look at the organizational and the group level, we can be provided with these types of technologies, but we need to understand how to use them effectively, how the manager needs to support us, and how do I interact with my team members? So there's all sorts of kind of different netting and kind of digital age of pulling them together. But it's also important to bring in those organizational structures and the infrastructure. So human resources, corporate health and safety, corporate real estate, the financial, all of these are key stakeholders, union management relations. All of them are important, and we need to bring those into the training and to set up what those effectiveness outcomes are going to be. So as we look at this kind of macroeconomic model that I call, it's important for us to consider all of these different elements and the synergy of those around each other. That external environment makes an impact on us, which we're all living with now. So what's the research gap? Well, we found that there were very few studies, lots of cross-sectional studies, but there were few studies that really were looking at this phenomena in a systematic way. And so we're going to look at it systemically, what are the work systems approaches and what we need to look at. So this study was undertaken right before COVID occurred, and we were able to set up a control group, which was working in a conventional office, and we had a virtual office group. And so our study was to look at those psychosocial perceptions, bring in the systems elements, mental and physical, workplace satisfaction, and performance. And so these should be able to help us as we go forward, how we're going to make these hybrid and blended environments. This was a model. On the left-hand side, the virtual office had a new work style. They were being sent home full-time. They had training on setting up performance management contracts with the union and management, specifically collaboration, how often you're going to be speaking with your managers, your performance goals. And then there was also training on how to set up your workspace at your home. The conventional office, they also received ergonomic training, and they had the typical office environments, which had not sit-stand workstations, but a typical workstation setup. So in the middle, where we're talking about, we have resources. One can have control of the work environment, how they're using technology, what the supervisor and organizational procedures are, and then you have the demands. You're adapting to this new work environment. You're adapting to new group interaction and supervisory relations. Our outcome variables are here, the impacts. We're looking at the physiological, psychological, psychosocial, and we looked at customer satisfaction, which served as a surrogate for our productivity measures. So we hypothesized that the virtual office group will report an enhanced job control that will be greater than the conventional office, a more positive experience of the office, working in a VO setting, such as less work interruptions, more control over work-life boundaries and the workflow, greater workspace satisfaction, because again, you're able to set it up to fit you, and you can arrange your work environment, less work-related musculoskeletal discomforts, because you can incorporate healthy computing breaks, less mental and physical stress, and a reduction in commuting fatigue. And then we were saying that there was no difference between conventional office and virtual office regarding customer satisfaction, because we were saying that both can accomplish their jobs. It's a prospective repeated measure field study. It was over 12 months, and it was self-selection of voluntary that's due to the union management agreement. So we had 2 groups, and all the groups included both managers and employees. This was a public service organization. They performed a variety of custom-based work, and they used computers, information, IT, and were working for at least 4 hours a day. And they performed fairly consistent in job activities. What was also important, they had a VO steering committee. These were sub-teams, brought in key stakeholders, which were IT folks, training, communications. They had an economic team that was taking measures, and they had a policy group. And then we also brought in the employees and manager training, as I've mentioned before, and there was minimal equipment that was sent home with the employees themselves, as you see here. What's important about here is our study timeline over the 12 months, strong union management cooperation, and we ended up with 137 folks in the virtual office and 85 in the conventional. What was also important, because it was a mixed methods, we wanted to do surveys as well as focus groups, but also the public service organization wanted to link this on the far left-hand side, these survey topics with their business results. So again, this is the strategic direction, the planning, evaluating what was important, how they measured those, and how you link it to the actual business results. Here's some examples of the variables that we used in our outcomes, looking at psychosocial and environmental, and then we have performance and well-being. And because this was a self-selection, volunteer self-selection, we had two what we call variables, control variables, looking at perception of the virtual office and satisfaction with the organizational support, which we used in our analysis because we knew that there would be some perceptual differences. So what did we see? What's very interesting is that we saw job control definitely. There were significant differences between the groups providing job control, group participation and decision making, and group interaction and cohesiveness. When we look at supervisory and work organization, we see supervisor quality was greater, significantly greater for the VO group. And the work interruption, there was no significant differences between the two groups. And with rest breaks, again, there was no significant differences here, meaning that they were taking their breaks. And with work interruptions, and it appears that both groups were able to concentrate on their jobs. Then when we look at self-reported workspace satisfaction, there was a greater satisfaction with the VO employees versus the conventional office employees, probably able to help them set up their work environment. They felt comfortable and they were able to use the workspace comfortably for those 8 hours. Interesting, we saw only a difference in the upper body symptoms. This was a yes-no response, dichotomous variable, but we did not see any differences in the lower body symptoms for the two groups, between the two groups. Physical and mental stress, we saw was less for physical and mental for the VO. For the mental, we did not see a significant difference, and for the physical, we did see a difference there. Customer satisfaction was a little better for the VO group versus the conventional employees. Excuse me. And now I'm going to share with you some of the focus group reflections. What you see here, we had 6 groups of focus groups, and I just pulled out a couple of the quotes that were very important, such as flexibility between their work-life balance. They felt that they could concentrate and manage their workload. And they really noted that how important it was to learn those groupware technologies and to use those effectively. The managers, their viewpoints here is it was very interesting that they said the employees' behavior became very results oriented. And this may be due to the management performance training that they went through. They set goals better, they set role expectations better, and they also started trusting their employees because they had established a formal process for communication. And with that, they were trying to maintain that sense of connections. What emerged was a true participatory approach by the groups themselves decided to figure out a creative way to stay connected. Newsletters, conference calls, they set up special emails, they planned virtual parties. And another observation by the managers was that they were creating agendas more effectively, and they were actually managing the teleconferences better. They were including everybody. They would make sure they would go around the room and everybody had some input. So they were listening better. Hence, the quality of communication was actually improving. So in summary, what we saw, there was a positive impact on employees' well-being. They were able to have an enhanced job control and participation. Decision-making was improved, a sense of control there. They had improved supervisory quality, workspace satisfaction, fewer reported symptoms on the upper body, and the reduced physical and mental stress and the physical commuting, and the greater customer service, which is again a self-reported performance measure. We always have study limitations. This was not a randomized study. We measure prior expectations to the telework and use those in our statistical control. And yes, they are surveys, so there's a rating. The strengths of the study is we took a work systems approach. We had planned trainings, we had planned evaluations, and that set up this performance management contract. It was a long-term study, so over 12 months, pre and a post, and we were able to compare the experiences of a virtual office to a conventional office. We had a very high participation rate, very small loss to follow-up, and very strong senior management and union support. So now let's take a step back. Let's take the learnings from this field intervention, taking some of the findings from the literature, what has been written in the last year or so. Many of those are cross-sectional studies to try to gain a sense of what is truly the issues out there and how do we move forward. So I put a continuum up there. On the far left-hand side, you have the in-person, you have a hybrid, and you have a remote virtual office. Now, how many days of a week do you come into an office? This is what was also decided with the VO teams in our study. That one thing that emerged is that the teams were starting, after the study was all done, in the focus groups, they mentioned that they would start liking to move, selecting one day a week when their teams could come together face to face. Therefore, they said it was important for them to set up what their jobs and work tasks were, reach those, accomplish and complete those tasks, and then the team would say, okay, on Wednesday, we're getting together, here is our agenda, and this is what we're going to do. And what we're looking at is, it's going to be a blend. Is it 1 day, 2 days, 3 days a week? We don't really know, but it's going to have to be flexible, and it's going to have to be determined by the manager, the organization, and the employees, and lining those goals together. So organizational readiness is going to be very important. How ready is an organization to take on a hybrid, blended, flexible work environment? We have to bring in key stakeholders, the technology, IT. How do we purchase? Should there be some compensation for employees who are working full-time at home? The cost of heating, air conditioning, depending on where you are in your location of the world, is shifting now to the full-time work at home. So should there be some compensation for those shifting of costs? What about the equipment? How much equipment do we send home? Do we have purchasing? And then we go back to the hybrid office. If we're going to have hoteling and multi-desk and sharing those desks, then we need to be worried about the health and safety of multiple users. How do we bring people in at the right time? How do we make sure there's social distancing at that time? We have to build the trust that that environment is safe for employees to come back to. This is why it takes a systems approach to involve the right key stakeholders. We need to evaluate and adapt those programs for sustainability. This isn't going to go away and we're going to start seeing this blending, but the organizations are going to have to constantly look at feasibility. Is it working? Course corrections, because there could be some other external environment impacts that could be pushing on the organization itself. So to start off, we're back to the issue, which jobs are going to be appropriate for people to work at home and or in a flexible hybrid environment? How is that going to impact management and their roles? And there's been some very good studies from my Danish colleagues, Christine Ibsen, who's looking at the shifting of this responsibility for managers and that distance managing. It's actually placing a lot of more workload on those managers to ensure that they're communicating, setting up role expectations, are my teams working together? Do they have the right resources? How do I make sure that if it's a public relations, that there's good client interactions that are still occurring? All of those need to be evaluated and aligned with the business strategy.
Michelle, it's Catherine. I can't hear you. I'm not sure if that's just me. Bettina, you could send me a quick
Okay,
note.
how's that?
That's better. Great.
All right.
Okay.
Thank you. I'll go back to the importance of designing training programs that is going to be the organizational responsibility and to provide supplemental resources. So managerial training is going to have to occur so that they understand how best to manage the VO and the hybrid work environment. The training that we had in our study was a 3-hour training, and it was for all managers and all employees so they could set up those communication strategies. So they could discuss how they're going to create a sense of connection, belonging to the organization, how they're going to engage with their managers, which helps them move into facilitating team and coworker interactions, how to set up what a day in the office. How do we replicate that digitally, or do we really need to have the teams come together? If we're moving into a hybrid environment, that they determine when that day in the office is going to be. Managers also need to support and help employees to build that trust, but also learn how to manage those work-life issues. The ability to disengage is very important, and this is where the mental health is starting to really show. It can be very important. We don't want to have burnout. We need to protect the employees and the managers. So if they understand it's okay to disengage, it's okay to put on your email that at 5 p.m. Eastern Standard Time, I will be stepping away from the desk. I will get your email the next day. So how do I set that up? How do I make sure I have permission from my office, my managers, and the organizational support? Setting up technologies. I think we've all experienced that, as I just experienced now. You hit the space bar, immediately puts you into mute. So those are all the little things. You know that, but you're focusing on the task. But you need to have those technologies supporting what you're doing and given that practice in the interaction. I've heard from many employees that they get these really neat group software technologies, but they don't get enough training, they don't get enough practices, so they end up kind of falling back to calling the person, setting up an easier Zoom call, because the time and the energy to spend that new groupware is pulling them away from their primary task. So this needs to be recognized. The infrastructure needs to be put in place. There's also moving into how you set up one's work environment. So here's the ergonomics. Now we cannot do the in-person at this point assessments, and now we're using tele-assessments. How do we set those up? How do we make sure that we're surveilling our employees, making sure they have the right resources? Because we want to balance the mental and the physical stress to make sure that they feel they are in control of their work environment and the ability to speak up and ask for help from their managers. It was also brought up in the focus groups, which has been described numerous times in the literature now, of don't forget the culture of the organization. Don't forget the norms that we used to have in a conventional office. How do we bridge that into a virtual office? And as we move forward into hybrid offices, how do we make sure that those cultures and those norms are being embraced? And that is another way of ensuring that people have that sense of belonging. And this is what will be important is that if it's driven by the teams and driven by the employees, then they have that sense of control, they can reach out. Now, when I come back to my hybrid environment, I don't need an individual workstation. I need collaborative spaces. So this is going to be shifting how corporate real estate is going to be looking at their offices and the design of their offices. Is it more collaborative spaces? Are the campuses going to have small groups, huddle rooms, large areas for employees to come back to work in teams? All of those aspects need to be considered. So one way of training, a new way of working, is customizing it for the corporate culture. These are just a couple of examples that we're working on. Is not only do you need to have a safety and health survey, you need to create some ergonomic guidelines and healthy behaviors to bring those home. But you also need to be aware of you as an individual, how you're going to create those work boundaries. And telling you, when I call them the house rules, we're all having to adopt new behaviors at home. So when I shut the door, I'm on my conference calls, I'm heads down. And if the kids are doing their work, we have to create those areas, a dedicated space, and be able to say, this is my quiet time. And so we also need to kind of consider different ways to connect with our teams. And some companies are kind of having fun with this by, in their virtual office parties, coming up with what are your favorite hobbies? How are you setting up your work environment? Sort of creating a sharing of those experiences. I'd
Michelle,
like to
you have
leave with
about
you.
5 minutes.
Thank you. I'm on my last 2 slides.
Yes.
Setting up and balancing our challenges on the left and the solutions on the right. So some of our challenges here, these are a few of them, is those resources. Resources from the corporation, the organization, having that infrastructure to support. And that leads to setting up training programs, ad hoc, maybe telework teams, knowledge teams, creating some kind of sense of belonging to the organization. All of those are, it's like that virtual office steering committee. They were the ones that sat down and said, how are we going to continue this teaming, this distance management to ensure that our workers' well-being is taken into account and our performance measures. Engagement and connection, have to look at opportunities for those connections. We have to have the support from managers to say, this is the best way that we think for our organization to bring in those cultures and those norms. Then we move into, as I was saying, with workspace design. We can have simple solutions we can use in setting up our home offices, but we also need to learn how to be flexible as we move into a hoteling situation. So the ergonomic knowledge has to be transferable. And part of that is now going to be setting up training programs to allow people to become problem solvers and to encourage them to exert control over their work environment. When they come into a hoteling situation, they're going to have to set up that workstation to fit them. They're going to have to express any needs that they have, equipment-wise, technology-wise, to their managers. So the manager, on the flip side, it needs to have the training from the organization to assure that their workers are safe and productive, and the trusting is going to be kind of that emergence. Work-life boundaries, the blurring, we all recognize this, being able to disengage, understanding we still need to incorporate healthy work breaks and routines, and ensuring that people can step away as well as come forward and be able to work with their teammates into different types of communication and different types of roles. So timing is going to be important. Asynchronous, synchronous, when do I need to have information and data? How do I exchange that with my teammates? Then we come finally to our performance and goals. With the planned ones, again, they had the time to set it up. We just had that abrupt shift into working from home. So it's kind of scrambling, kind of catch up to say, how do we set up goals? How do we set up performance expectations? And we know that the outcome, if you don't have a sense of control and the demands go up, then we need to be concerned about those outcome variables of physical and mental stress. So in order for us to manage those goals, expectations, and performance expectations are very critical to set up. So here are some resources. There is a couple technical reports that should be coming out. We were working on with International Labor Office and organization, the IEA. We've written some think pieces on this. We also set up technical notes, and those should be coming out by the end of the year, which will help. But you can have some links here, and I'll provide some more. And these are just resources for you as we reach out. And I think our opportunity in the health and safety and ergonomics world is we have a wonderful opportunity. We should seize it so we can really bring our expertise in and to help managers and organizations to establish these healthy workplaces. So I thank you for your attention, and I look forward to the questions that are coming forward. And this is just kind of, let's look at it from a systems approach and bring them together in the interaction that occurs on the employee, which is a manager or an employee themselves. Thank you very much.
Thank you so much, Michelle. What an excellent presentation and a lot of food for thought. I do want to get to our questions right away. The first one is related to workspace design. So it was indicated that the virtual group had increased workspace design satisfaction. Can you just review the workspace design process for this group for us?
Yes. They had the virtual office participants had ergonomic training, so they knew the minimal equipment that they were going to be taking to their home environment. It was sort of a pamphlet, here's an ergonomic guide to set up. They were not given a new workstation by means of a chair or a desk or anything. They used their existing but we also provided simple solutions for them and encouraged them to have that sense of control over their workspace. We've seen this increase in job control and environmental control and its impact that it makes on musculoskeletal symptoms and other health outcomes, as well as productivity in several of my earlier office ergonomics interventions. So this is why we hypothesized that with an increase of job control, and what I call permission to move things around in your office so that they fit you. And that was the primary philosophy we gave. And we encourage them to use the resources. And managers are also, were trained on those ergonomic principles. So they could go back to their managers and say, I'm struggling here. And then they had a corporate health and safety office that they could reach out as well.
Okay, thank you, Michelle, for that. Related specifically to the health and safety employer liability, did anything come up related to the virtual office employee having an incident related to falling down the stairs or anything that might have happened to them during the work hours?
That's a very good question, and those are the legal considerations depending on which country you're in. Worker compensation is part of the ergonomic and safety and health training, and part of the ergonomic safety work environment survey that we had them complete at their home. Part of it was to address what we would call traditional slip, trips, and falls hazard, cable management. A couple of the pictures that I'm showing here, this is where we were trying to help people not to have those hanging over their edge. We do bring that into consideration. Part of the infrastructure that needs to be addressed from a legal aspect is that where do you draw that line? Where is it the employer responsibility and the employee responsibility? And that's a very important boundary because you still need to protect the worker. Just because they're working at home, you still have to protect that worker and provide them with those resources. So a lot of times, some organizations will really go through the liability issue and look at the risk management, and they will walk them through to ensure that their home environment is set up for those legal issues. So it depends on the organization. It depends on where you are culturally and location-wise around the world. And that's important. What is the norms and the policies and practices of that organization to address that? So those are part of those formalized policies and procedures that management, senior management, needs to clearly define for the managers and for their employees.
No small order.
Mm-mm.
Any sense, Michelle, on how you scale these findings for small to medium employers? And I know you have quite a bit of expertise in this area.
Yeah, the very good questions. I think it's all a matter of resources. You working in small organizations, you may not have the equipment and the resources there available, yet the principles are still the same. You still need to help your managers, even you may have one manager and 3 employees. If they're all at home, you still need to know how to communicate. You still need to set up role expectations. You need to set up performance goals. How often are we going to get together? So you need to address those regardless of how small or large your organization is. If you don't have the resources, this is where, I would encourage small, medium-sized companies to reach out to the World Health Organization. They have excellent resources and pamphlets, and bring those in. You may not have an in-house corporate ergonomist, but we have the resources that you can bring them in to address it. It's the awareness, it's the acknowledgement that I need to look at all of those areas here to help my employee be safe, enhance their well-being, and make sure they're productive.
Thanks for that, Michelle. And back to the liability issue, did it come up anywhere that people actually were injured or put in a claim related to their working from home situation?
In our study, we did not have any worker comp claims that arose. We have the philosophy that was taught in the ergonomic training is just that if there was any discomfort that was starting to emerge, they were immediately supposed to report those to their managers and then reach out to the corporate resources. So the norm, the philosophy of the organization was report early, report your symptoms early. And I think that's a general philosophy that should be carried. Don't wait until the discomfort becomes to such a high painful level. We need to catch it earlier. And what are some of the preventative measures we can put in place?
Thank you for that. Do you think governments should be drafting regulations related to minimum work conditions and benefits for all workers during homework?
That's a very good question. And I think that's where, in our role with IEA and the work that I've been doing with ILO and WHO, is to try to bring in a guideline. So the think piece that's available now is helping managers and organizations and employees look at physical, psychosocial, work organization, manager and organizational responsibility. I think we can provide guidance and recommendations, and those are emerging. I'm also working on one for the United States, which will go up to Capitol Hill as a policy. Will it become a rule? That's a fine line, but we can certainly give them guidance of how the human factors ergonomics scientific discipline can help employers to address these very important issues when they're moving into. Now we've got a flex of people. Some companies are opening, some are not. So those that are not opening and bringing in the flexible work environment, it's time to take a step back and to really think of a systems approach, set up a plan. So those are the guidance and the directions that we're providing now. And that's what I'm hoping that those will be put out. We're hoping by the end of this year.
Thank you for that. And for the virtual working group, did the data reflect a desire to go back to the office, either full-time or in a hybrid fashion at all?
Yeah, that's another very good question. It did emerge from the VO participants at the end of the year study, and this came up in the focus groups, is that they did want to go back to the office maybe one time a week, but they wanted to decide when to do that because they wanted to work with their coworkers and say, let's set up these particular tasks. When we get those done, then let's meet together. So they wanted to come back 1 day a week is what they were proposing. Then the organization needs to respond to, okay, when this team comes back, where do they work? How do we make sure that they're going to be working in a safe environment? So they need to create those collaborative spaces on their campus, ensure all the prerequisites before they were coming back. And they wanted to embrace that collaborative work. So I would suspect, just looking at the data, hearing the focus groups, hearing what others are saying in their cross-sectional studies, that there is a sense of wanting to belong to an organization, and one way to create it may be not 100% working from home. Not all tasks may be amenable to those. And there is that creation of bringing everyone as a team. If you allow them as participatory approach to determine what that is, then you've even created more of a sense of control and more flexibility. So that particular VO group was actually starting to move towards those. Now, the study ended literally before COVID hit, so they were moving in that direction to try to decide how they were going to create and set and establish 1 day, 2 days, which day it is, and taking into consideration people's commuting, where they're co-located, how do I sign up for a collaborative workspace? Do we go to a satellite center? All of those questions were starting to be raised.
Thanks so much, Michelle. We've actually run out of time and we have a couple of questions left. So I would encourage the individuals that have questions to reach out to you virtually. We look forward to hearing any future information you have going forward, Michelle, and want to thank you so much for a very, very informative talk. We encourage everyone to join us for the upcoming webinars. We have 2 more in this series, and also we are working on a survey as well that I know you'll hear more about in the coming weeks. So thank you all, and wishing everyone a wonderful weekend.